Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the available knee injections for arthritis? Well, just an overview on knee arthritis. Over 40 million Americans currently suffer from arthritis. It's the leading cause of disability in this country. There are more women than men suffering from arthritis by about 20%, and the total costs, direct and indirect, for arthritis treatment exceed $100 billion a year. In the years 2000 to 2010, the number of knee replacements in the U.S. doubled to about 600,000. And by 2030, estimates showed demand could reach 3.5 million knee replacements a year. And of note, 35% of those are done in those 50 to 69 years old. So if you consider that a knee replacement, average lifespan is about 20 years, you're looking at a lot of people who may need a revision and could definitely use treatment that could prolong the need or delay the need, for the knee replacement. So knee replacement is a quality of life procedure. It's elective. Doesn't have to be done. Knee arthritis never killed anybody. Over-the-counter non-steroidal anti-inflammatories and Tylenol should be tried, for mild to moderate arthritis pain. And prescription pain medications, when exacerbations occur, can help. Topical medications like capsaicin, creams for anti-inflammatories, lidocaine patches, physical therapy, and bracing can all help dramatically. Bracing could be an unloader brace. If you have arthritis in one compartment, it can unload that and provide relief. So knee injections are a vital part of the non-operative treatment for arthritis. And there are multiple different types we're going to talk about. One is cortisone, the old gold standard. Then you have hyaluronic acid, which is also called viscosupplementation. And then you have the regenerative medicine category, which consists of PRP, which is platelet-rich plasma therapy, BMAC, or fat-derived, BMAC is bone marrow aspirate, those are stem cell injections, and then amniotic-derived stem cell injections. So cortisone is what we're going to talk about first. For over 60 years, steroid injections, steroids another name for cortisone, have been a mainstay of knee arthritis treatment. Initially, they were done for rheumatoid arthritis. They worked so well that a few decades later, they spanned over into osteoarthritis, wear and tear arthritis. They don't cure anything, but they do help dramatically to decrease inflammation and for pain relief. It is questionable whether or not they actually harm cartilage. There's no studies that show definitively that they do, which is one reason they're still widely used. And studies show that 75% of patients achieve good to excellent pain relief for maybe months at a time, when the injections are done. So they are still the gold standard for knee arthritis. Hyaluronic acid injections are also called viscosupplementation. We all have hyaluronic acid in our joints. That's the motor oil that's normally found. You need that to help with lubrication. In 1997, the FDA approved the first hyaluronic acid preparation for clinical use, and that's made from rooster combs. It's not made from other humans or synthetic. So there's numerous trade names that are now available. A lot of people know Synvisc. There's also Orthovisc or Hyalgan. Studies have shown that none of these products has superiority over the other. One of the largest studies in the United States looking at these products showed beneficial effects in 80% of patients for over 6 months' time. There's been another study that was a very good study that showed 65% good to excellent results at the 1-year point from viscosupplementation. And the theory is that they provide lubrication, they provide anti-inflammatory effects, and they also compel the knee to make more cartilage. We don't know if that's actually true, but that's the theory of what happens. PRP therapy is platelet-rich plasma therapy. And this has come on strong in the last few years for knee arthritis and knee pain issues, as well as soft tissue tendinitis and ligament injury all over the body. It involves a simple blood draw. It can be done in the office. The blood's put into a centrifuge, spun around quickly for 15 minutes, and there's a layer that ends up with concentrated platelets and growth factors. That's the layer that's taken off and used for re-injection into the painful knee. And what it does is it provides a lot of the platelets and growth factors to help with repair, but it also calls in a lot of stem cells from the body to further help with repair and regeneration. So multiple studies have looked at PRP therapy for the knee. There's one that showed 70% good to excellent results at 6 months. You may need 1 to 3 injections over that time period. And also one at a hospital for special surgery that showed with serial MRIs over a year, the preservation of cartilage was seen in over 70% of patients. So not only does it provide pain relief, it can also help preserve cartilage. And when you get into frank stem cell injections, we're talking about the potential to alter the course of arthritis and not just to mask pain. And you have 3 different types: bone marrow-derived stem cell injections, fat-derived stem cell injections, and amniotic-derived stem cell injections. These are all mesenchymal forms of stem cells. They're not embryonic. They're not fetal. Okay, so there's no ethical concerns with their use. The bone marrow-derived and fat-derived need to be harvested from the patient, him or herself. It can be done in the office. The bone marrow comes from the iliac crest, and that's, can be a little bit painful. And then fat-derived just comes usually from the abdominal area. And these are outpatient procedures, very low risk. Amniotic-derived, on the other hand, comes from somebody else. It's from amniotic fluid from a consenting donor. Normally it just gets thrown away with a C-section, and it gets processed at an FDA-regulated lab, and it has huge amounts of stem cells, and it does not cause a rejection reaction or anything like that. So it's been very good. It's been used over 10,000 times throughout the world for various indications, such as arthritis, wound healing, tendinitis. So research is not too prevalent, but there was a study looking at 9 patients and showed 6 months after transplantation of the stem cells, the patient's clinical symptoms had improved, and the improvements were maintained over a long-term follow-up. There are a lot of small studies looking at stem cell injections that have been hopeful, but not statistically significant. The bottom line is there are various types of knee injections available. All of these are low risk and outpatient, and in combination with other available treatments that are non-operative, they can help delay or maybe even avoid the need for a knee replacement. All can be repeated every 3 to 6 months as needed. In Nevada, the top pain management doctors are with the Nevada Pain Network. Comprehensive pain management treatments, both medical and interventional, several locations around Henderson, Las Vegas, Summerlin. Over 50 insurances are accepted with over 50 available treatment options. The doctors are board certified. They've won the Patient's Choice Award 5 years in a row. So call today at 702-323-0553. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.